Hey, I'm Dr. Spencer Russell.
And I'm Dr. Alex McCree, and today we're going to tell you how to clean your All-On-4 dental teeth.
Okay, so you just had your procedure completed and you're wondering how exactly do I clean these? So for most people, you're going to be going into a temporary right after surgery, and so this is a 3D printed material. So it's very, very pretty, it's very smooth, but you're going to have to do a really good job of keeping this clean. So this is going to be sitting up against your gum tissue right after surgery. So those first 2 weeks, what I want you to do is just very gently brush the outside of the teeth, the inside, outside here, but staying away from your gum tissue. And then you're gonna do very warm salt water rinses, very gently at first, and then progressing a little bit harder over the first few days. We'll see you back in 2 weeks, and then that's when we're gonna go over how to keep them clean for the next few months. So, go ahead.
Yep, no, I was just letting you transition into the water pick here.
So, we've got the brand we recommend is the Waterpik Ion. And so what this does is, as this bridge sits up against your gum tissue, it's like a little mini pressure washer. You're gonna use it to squirt underneath the bridge all around, and that's gonna keep any food, bacteria, everything away from the bridge. So there's a few different tips here. I recommend these two the most. So we've got one that's a little angled. You're gonna be able to clean from the front really well. It's gonna squirt right along here. You're gonna start with it on like a 2 or 3 setting at first.
You don't wanna go on the hard pressure first. You know, just take it easy and get used to it.
Yeah, and so you're just gonna run it along the gums here. And I like this one for the outside because you can see it's pretty straight, a little bit of curve. It'll fit up underneath your lip nicely there. And then this one they call the implant denture tip. If you buy the Ion, it comes with it, or you can buy it on Amazon by itself, but you can see this one's got a nice little hook, so that way you're able to get onto the inside and then it squirts underneath really well. So very, very important during those first few months of healing for you to brush these, keep all the stain, food away from them, and then use this Waterpik twice a day. Now,
and that will be forever. Okay, so that after 2 weeks, you do that 2 days, 2 times a day, forever. And that if you do that, the implant health will stay as good as it possibly can.
Yeah, and so then after 3 months, of course, we're gonna make your finals. So the difference with these being zirconia is they're much, much smoother. Everyone always says it feels like you got braces off or something like that. You can't, your tongue just loves it, how smooth it is. So with that, you're gonna get a lot less food sticking to it. Like Dr. McCree said, you still have to use the Waterpik twice a day, but you'll notice it's much easier to keep it clean now that your gums have healed into place and we have a new bridge sitting really nice and tight. You're not gonna get a lot of stuff stuck underneath there, but still continue to brush it. That's gonna keep any plaque buildup off. Continue to use the Waterpik twice a day. That's gonna keep everything out from underneath it. And then the other thing I also recommend is, it's gonna sound weird, but a dilute bleach rinse. So you're gonna take regular bleach, no splashless or scented or anything like that. You're gonna mix 2 teaspoons with 16 ounces of water. You're gonna mix it up really well. You'll put a little bit of it in here, and then once a week, once every couple of weeks, you're just gonna squirt that underneath. What that's gonna do is that's gonna kill off any of that bacteria. Make sure you're keeping your gum tissues, the implants, everything really nice and healthy for the long term, so that way this is gonna last you a lifetime.
The only other thing I would recommend before we go today is that's best for at-home use, but we have a lot of patients that are truckers or people that are just on the go and vacations, and people that are from out of town. I would recommend this for at-home use. They also make portable battery-powered ones. So that's great for your everyday use, but know that there's ones that you can fit in your purse, fit in your console, so you can take them on the go as well.
Yep. So that's it for today. I'm Dr. Spencer Russell.
I'm Dr. Alex McCree. Now you know how to clean your teeth.